I'm Anthony Santiago. I'm a senior fellow at the National League of Cities. I'm going to invite our panel up. On our panel this morning, we have Ruth Norton, David Jacobs, and Wesley Priem. For those of you who are not familiar with the National League of Cities, we're the oldest and largest national organization advocating on behalf of municipalities. And so I actually work in a special division called the Institute for Youth Education and Family. So for all the work that you're doing locally, would love to hear about how effective your municipal leaders are working with you, but also how, in what ways your local leaders can help you improve and play a bigger role in the work that you do. In terms of bios and introductions, if anyone needs little introduction, it'll be Ruth Norton. As you know, President and CEO for Green and Healthy Homes. And if you don't know, the organization's been a national model, started back in 1986. So she started when she was 12. To her left, you have Dave Jacobs. And so, who many of you do know, but I'm also going to just kind of go through this really quickly. He's the chief scientist at the National Center for Healthy Housing. He also serves as the director of the U.S. Collaborating Center for Research and Training on Housing-Related Disease and Injury for the World Health Organization, and is an adjunct professor at the University of Illinois at Chicago of Public Health. He's a principal author of the President's Task Force report on lead poisoning in 2000, and Dr. Jacobs is the former director of the Office of Lead Hazard Control and Healthy Homes at the U.S. Department of Housing and Urban Development. To his left, we have Wesley Priem, who's the Michigan Healthy Homes Section Manager. The section has received continuous HUD grant support to reduce lead hazards in nearly 3,000 homes since 1996. The section was awarded 2 Healthy Homes demonstration projects, and he has co-authored a technical paper on the evaluation of healthy homes principle. In 2006, Mr. Priem was appointed to serve on the Governor's Child Lead Poisoning Prevention Commission and was appointed to manage the Medicaid CHIP Healthy Services Initiative, which provides $24 million per year for 5 years for lead abatement of homes. So without further ado, we're going to start this panel with a little bit of an overview to give the audience a bit of perspective from our panelists on their experience in the work and guiding and developing and making recommendations for both local and national policies. So if we can start, perhaps Wesley, we can start with you, Ruth Ann, and then we'll work our way back.
Either one is great and fine. It's wonderful. Good morning, and thank you again for your great engagement, and thank you, Anthony, who's helping to lead a really great dialogue with mayors on health and hazards in the home through the National League of Cities. I think as we start to have a discussion around policy, I believe very much in ground level activity. And I think we're going to talk a bit today about what we believe should be done at the national level. And we have a great piece that we handed out called the Abridged Playbook to End Lead Poisoning. And if you've looked at your electronic flip book, we've given some thoughts on what we think collectively should be done. And on this day that Ben Carson has been named to be our next housing secretary under the incoming administration, I think the point about policies linking health and housing become critically important, and we're hopeful that the neurosurgeon who hails from Johns Hopkins in Baltimore will be a leader in helping us think about that connection. So on the national level, many things that we've learned at the local level, we're making recommendations to advance. We know a lot about tracking children through blood lead levels, but what we know from places, from examples in Maryland, for example, tracking housing is critically important to get an assessment of where we must go and how we must spend our money. And I know that Dave and I and Wes will talk a lot about this, but it will take resources. What works and what is shown to work in states around the country is money to help those who are financially strapped. And I think we've calculated that it's about $12.5 billion just to address to 1.25 million homes with lead hazards and low-income children over the next 5 years. But we also know that standards matter. So in places like Maryland, we set standards for cleanup and clearance before occupancy. And so the majority of the money, the majority of the impact that you heard Governor Bob Ehrlich talk about yesterday, has come from private sector investment. And that's really critical. And one of the things that we are calling for, both from DHHS and then our collective, is that federally owned and insured and backed housing also must never go to the market. If we know that it's hazardous, if we know that a child's been poisoned there, and we need to find a way through private sector investment, through public investment, but we certainly should have the moral compass that that which is owned by government should be the first in setting the example. But private sector will also matter, and we'll talk a lot bit more about that. We're going to hear later today from Assistant Secretary Nicole Lurie about the investment, and Wes may touch on this, that Medicaid is making in Michigan. But we have to make the case to the healthcare funders and to the education funders. And to get to that $12.5 billion investment, we have to set standards, and we have to find ways that the private sector, health insurers, property insurers, and others can invest, and invest early. And then we need to be proactive in places like Maine, where they're now doing environmental investigations and funding them at levels of 5 micrograms per deciliter, and making sure that all properties, which are being done in many states around the country, if a child is found to be poisoned in one unit of a building, that we clean up the entire building. There's much to discuss in this. I want to get to the really smart and handsome panelists that we have, and young, to my left, and let them engage in this, and then we look forward to talking with you.
That's Wes. So I just want to say where we are in this meeting, because now comes the hard part, right? What exactly are we saying we should do? What's our strategy? What are the specific policy changes that we want to see happen to deal with this problem? So I want to talk about what works and what's needed. So we kind of know what works, right? That's been researched. We have technologies that are effective. They're accurate. We have a skilled, licensed, and trained workforce to carry this out. It's not big enough, but the architecture is sort of there. And we have enough of the pieces now to recognize that we have to stop this business, as I said last night, of chasing kids who have already been exposed. That's just stupid. So the time has come to put an end to that. Broadly speaking, I think we can group what we're talking about here in terms of what to do into several domains: financial, legal, institutional, cultural, behavioral, environmental, and technological. So I think the overall sense is the time has come. Things are broken, we need to fix them. We're not going to use our kids as detectives anymore. Let's use the technologies that are out there. Let's use the protocols that actually work. Let's find the source. Right now, we have this odd situation, don't we? We have highly concentrated lead sources, whether they're in pipes or in paint, but they're dispersed throughout the housing stock and throughout the country. So that makes it really hard, right? It's dispersed, so it's going to be expensive to fix it, but it's also highly concentrated. We haven't really faced sources like that. Phil mentioned previously the gasoline thing. Well, the way that was fixed was we just went to central refineries and said, take the lead out. It was centralized. This is going to be harder. Also, the other part of the realization here is that lead poisoning prevention is part of the mission to provide affordable, safe, and sanitary housing. This goes all the way back to the 1936 Housing Act. It's part of that struggle. We have predecessors who did this before. If you go back 100 years, we had the sanitation movement. That's how this country wiped out cholera, tuberculosis, and typhoid. It was through better medicine in part, but it was also through a common housing intervention, which is, we take all for granted now, indoor plumbing, right? So there's no reason we can't do something similar like that. So this is a high cost. It's stupid to just keep absorbing the costs or shifting the costs of lead poisoning to schools or to medical care systems or to our families. We need also a recognition that the solution requires a redefinition of what we mean by infrastructure. And that's the buzzword currently, right? But most people don't think of homes as being part of the infrastructure. I think they are, right? We buy them and sell them to each other. We invite people over. It's a shared common. Now, obviously, it's also a private source. But I think most people would have argued and would have expected the pipes in Flint were part of our infrastructure. And yet, it turns out legally, they're not. The part that's on the private property, you as a homeowner own. So we need to think more broadly about what it means to be infrastructure. And those lead hazards are unfortunately something that we share. I think it should be part of the infrastructure bill that we're talking about. And finally, I think we need a realization that this work that we're talking about, we call it lead abatement in the lead field, but it really is sort of a specialized form of rehab. And so these jobs will be good jobs. They'll be for carpenters, they'll be for window installers, they'll be for industries that manufacture windows and building materials and pipe replacements and the like. So I know Russ is going to talk some more about local issues, but my main message here is that we can no longer just do this Band-Aid thing. We have to have both short-term and long-term approaches. And historically in this country, there's a tendency to just go with the short-term strategy. I mean, it was mentioned, I helped write the President's Task Force report back in 2000. There were 2 estimates in that report, right? But everybody only used the short-term interim control cost estimate, not the longer-term thing. So the time has come to think about this in a more cohesive manner. And from the housing world, we actually do this, right? You have maintenance, right? And then you also have capital improvements. So if you have a leak in your roof, you can patch the leak in the roof and that'll stop the leak, right? That's a short-term approach. It works. It stops the leak. But the time's going to come when you have to replace the roof. That's a capital improvement. For lead hazard control, we should need to do the same thing. Integrate those 2 approaches so that it makes sense. And then I'll save my gunpowder for the discussion. Go ahead, Wes.
So I changed my presentation 15 times since I've been here, since I've been listening to all you experts. And I said, okay, so what do I want to say? We all agree that it's going to take 2 things to do this. And it has taken 2 things to get us here where we've been for 20 years. And that's legislative policy change to change behaviors in the way we do things in this country. And then it takes money. So we've all agreed on that. And that's the purpose of this summit, is to energize us, educate us, to make that next move to eliminate childhood lead poisoning. We've done a great job. If you look at the chart in the state of Michigan, the number of lead-poisoned children that have gone down in the 20 years, if I was in business, I'd be a millionaire, because we've made such great strides in lowering those levels down. But like we all agree, now we're at the point where it's still getting harder and harder and harder, because we lower the level of lead-poisoned children, blood lead level, and I hear that it's going to lower again. So that makes it even more difficult, because now we're putting more demands on our inspectors and our lead abatement firms to get cleaner and cleaner and remove more and more hazards from the home. So what has Flint meant then in terms of these 2 big issues, policy and funding? Flint has been extraordinary in my terms of 20 years at the state. I've been in a governor's lead commission when Governor Engler was in office. And as the governor from Maryland mentioned last night, everything's a crisis, right? Everything takes priority. But then when a real crisis hits, they form a governor's lead task force. So I was with this under Governor Engler. And then Governor Granholm came along, and lead was not on her priority list at all. And then we had a child in Detroit that had 104 blood lead level. And that hit the newspaper. And it's just a miracle that that child didn't die, correct? At 104. And so then the first thing, Monday morning after that hit the newspaper on Sunday, I was called into the director's office and said, Wes, what are we going to do about this? And we formed another lead commission. Well, with Flint, a little bit different, right? Didn't have time to react that way. And so the governor's office has put a lot of effort into solving this problem. You may not hear that on the news to the same extent that I have lived it for the last 2 years. But this office has dedicated millions of dollars to every aspect of this, to lead inspections, to lead abatement, to nutrition, to case management, to infrastructure. They have taken this seriously. So then they did form a task force. Rebecca is here with us, and she's on the task force along with Mona Hanna and Tisha. There's 12 of us on this task force. It was different than the last two. The last two, the governor's office did not participate in these governor task force. It was just appointed down to the directors of the different departments that had a stake into it. This one, our lieutenant governor actually facilitated every meeting. We didn't meet every 3 months. We met every week. We didn't do one assignment. We had multiple assignments. So we were spending on the average of 12 to 15 hours a week to come up with the recommendations. The governor's recommendations are available. You just go to michigan.gov and look up the Childhood Lead Poisoning Prevention Report, and you will see these. Now, what is so neat about these is that what we've talked about here is what's happening. Within the first session or two, we had all these experts, great experts, and we said, let's not just talk about what we can do, let's talk about what we must do. Let's get, and as the lieutenant governor said, let's get to the ideal situation of eliminating lead from all sources. And so Rebecca talked about lead weights, we've talked about air, and there's one refinery, one smelting plant left in Michigan that makes brass fixtures for faucets. And so what can we do about that? Then we talked about soil. And right now they're talking about lowering the level of soil from 400 down to 190, but in the state of Michigan they're talking about taking it down to 110. So these are all things we talked about, every single aspect of lead and what we should do about it. Now, of course, talk is cheap, right? These are recommendations. What will be the crucial point is how the governor's office takes these recommendations and turns them into what we talked about, the policies and procedures and the legislative action that is needed to make this change. Funding. Again, the governor's office immediately started giving us funds. You know, we've for years worked so hard to get those HUD grants. They are competitive, as you know. And so we started to get millions of dollars. I got several couple $1 million for lead inspections and lead abatement specifically for Flint. But now, through our new Medicaid director in our office, Chris Priest, he worked very closely with CMS to come up with CHIP dollars, the Child Health Improvement Plan, when you need a state plan amendment. My role in that was to help write the technical parts of the state plan amendment. I am not a Medicaid expert. I don't pretend to understand how this all works. It's a lot higher finance than I know. But there's a 10% administrative fund at the state level. So the $23.8 million that we have coming is part of that 10% administrative cap that the state has discretion to use. So that is going to be, that plan has been signed. It starts January 1st. It's for $23.8 million for every year for the next 5 years or until all the lead is gone. So that's huge. That's 1/5 of HUD's budget. And so we're going to be starting soon to determine how to get that money out into the homes and make a big difference. That will address inspections, lead abatement, water, faucets, lead service lines.
So Anthony, yeah, sorry?
I just want to do a follow-up question because I think this is a good segue into specific policy examples. And so, you know, there's a number of states that support education on hazards, and even a larger number that allow for states to adopt stricter standards than federal. I think Arkansas is an example of that allows municipalities to adopt stricter standards for themselves. I would like to hear from the panel, thinking about that frame as we kind of strategize in the find it, the fix it, and the fund it frame. If you can identify either an existing policy example that can serve as a promising practice for replication or even federal adoption. So this doesn't have to be a local ordinance, it could be state, it could be a federal recommendation, but if there's something that kind of comes out of your wealth of experience in this area that you can highlight for the folks in the room.
Well, I think one thing I want to make sure we think about here and not to forget, there is no safe level of lead, and yet there are way too many state, local, and federal programs that call themselves prevention programs, and yet in my own city, our prevention program has services that start after a child gets poisoned to a level of 5 or above. We have to stop that language in order to truly invest in prevention. When I was on the... So let me throw out a couple of things that I think are critically important in this. Right? We are looking, I couldn't agree more with Dave on the infrastructure side, and then the calculations that Dave and I and others did together. We're looking at an opportunity for 52,000 jobs to be created with contractors being the face of healthcare by investing in this. But an example in Maryland where we went beyond and to move private sector and public sector where standards matter. You cannot, as a landlord in the state of Maryland, go to rent court and take a rent court action against a tenant if you are not in compliance with the lead poisoning prevention law. Because what we said was, look, if you're a good guy or a good woman and you're complying, great, that you should be able to use all of the tools available to you to keep responsible tenants. But if you fail to comply with the Maryland Lead Risk Reduction and Housing Law, we are going to stop you at the cash level and say you can't go to court to collect rent if you have a de facto illegal rental. And we have to ensure that every program that takes a public or philanthropic dollar that invests in housing condition include in that housing condition lead safety and lead-free housing.
Before I give you my specifics, I just want to mention that what Wes has done and others have done in Michigan is pretty historic. When I was at HUD, we fought with CMS to kind of get them to even pay for home visits, and that was dicey. Now they're going to pay for abatement, pipes and paint. That is truly historic. So we're going to talk more about that later on today, but I just want people to think about, how do you bring medical dollars into this field? My main things are, by the way, find it, fund it, fix it. It's on paper. I'm old school, I guess, but it's in the back. We didn't quite get the whole thing into the playbook. It's our fault, not anybody's fault. But so take a look at some of the specifics. So if you want to find it, the fact is most houses have not been inspected. The expectation in 1996, when we passed the disclosure rule, was that people would get their homes inspected. It didn't happen, so it failed. So the original version of that bill would have required an inspection and risk assessment at the time of turnover, so that people who are moving into a home, what better time to finance lead hazard control than when you're taking out a mortgage or refinancing a mortgage. So that disclosure law, in my view, needs to get fixed if we're really to identify the problem. And it should include not just paint and dust and soil, as it does now, but also water and other sources. The other thing is, if you have a child in a multifamily housing unit, let's not just inspect that one unit, right? I mean, there's probably a common maintenance history in that building. There's probably other kids who are also at risk. There's no reason to wait for multiple kids to have a problem. And then I think the windows thing that Ruth Ann already mentioned is key. If you think about windows, you get multiple benefits, right? Windows are the highest source of dust and paint and contamination. You also get energy benefit, you get jobs not only for window installers, but also window manufacturers, and you also get an increase in property value. Because people like new windows, they'll actually pay more for a housing unit that does that. So there's other policies I think that we should argue about, but it seems to me, finding the problem methodically, mapping, as we say, but not just neighborhood level, but actual surfaces within specific housing units so that we know where to focus our attention, and then bringing the forces of the market as well as other enforcement mechanisms to bear so that we actually remediate those issues by time certain.
Yeah, we talked about this last night, and Ruth Ann mentioned this too, but specifically is code enforcement. In Flint, 60 to 70% of the homes that these children living in are rental properties, and this has been a big discussion here. So I do enforcement. I oversee the enforcement program for the state of Michigan as well, and we have something called a landlord penalty bill that we offer both a carrot and stick in the state of Michigan. We go to a rental property owner and say, your home has poisoned this child. We're going to offer you a grant up to $10,000 and let's get it cleaned up. It blows my mind that rental property owners will not take free money. But it happens all the time. And so then what happens is that we'll cite them and say, we're going to cite you $2,000, and then if you don't do it, $4,000, then $10,000. And then we start to get their attention. But then what happens, and somebody mentioned this already, is what they will do is they'll sell in Michigan under land contract, which was close to what you had said earlier today, is this rent-to-own business. And so then all the laws stop happening. So then what we have to do then is go to the local municipality to red tag that property, which becomes hard once it becomes a rent-to-own or a land contract. So what I'm getting at here is we need both. Michigan has both, but it's still going to take a lot of work, and we need to somehow empower local housing officials to have more control over housing, specifically rental housing, because lead is a dangerous health issue. And if that house had open wiring, would we allow that to be an occupancy? No. Then why is lead any different? So enforcement of codes.
Great. And before I go into our next question, I just want to encourage the audience, if you haven't already went on to the website for slido.com and put in the code NLS, please do so now. We're going to actually, in the question and answer phase, that are not only going to include our current panelists, but our two previous speakers, we're going to try to pull questions from there. So if you don't want to ask a question yourself, but you see one that resonates, just click like. Those with the most likes are most likely going to go to. Please do that. And so, David, with resources always being finite and effective policies that focus resources where they're most needed are a great way to maximize impact. Would you mind speaking on how federal policy can help support states and cities with additional resources or methods that can most effectively utilize those limited resources?
Well, I think we heard last night, didn't we, that a lot of power is going to devolve to the local level. So it's interesting that Wes would talk about codes, because I think that's an opportunity. Those are all, arguably, it shouldn't be this way, but every jurisdiction basically has their own housing code. It's kind of fragmented. It's unlike medical care, right? If you get an appendectomy in Seattle, you hope it gets done the same way here in DC, right? With housing, it's different. It's scattered. And frankly, we kind of gave up on the code folks in the early 90s because they just said, we don't do health stuff. That's, we're going to send that to the health department. And so the time has come to get back at that, because those are the folks who really do know housing as a system. So I think finding ways to encourage things like the National Healthy Housing Standard to be adopted at the local level, which includes some paint stuff. I mean, paint is still optional in the model codes in terms of lead paint. So I think that needs to get fixed. Targeting resources, it's still the case that the main source of funding is the HUD Lead Hazard Control Grant Program. There's it's kind of gotten fragmented. I think it should be boiled down into one program, not 2 or 3, and it should be focused so the local jurisdictions don't have to go, it's too small. That's the bottom line. It's too small, and the fact is that there's a lot of effort that people do. I mean, when I was at HUD, we had all these grant applications. Most of them were great, but we could only fund, less than half of them. So it was really frustrating. So if we get the resources that we need, let's make it something that's accessible to all jurisdictions, not just the few who happen to write a particularly good grant proposal. That's a lot of wasted effort in my view. It should be more like a community development block grant where it's formula driven and it's based on need and capacity and the like. But I'm sure there's a lot more there.
Ruth Ann, getting innovative local policies in place require a champion with authority, right? And it also requires collaboration with multiple partners. Can you describe some brief examples where local leadership, in your role, kind of this national position, where local leadership really stepped up and brought all the right stakeholders to the table to bring about policy change?
Yeah, so I'm going to go outside of Maryland, surprise, surprise, but we're going to hear this afternoon from Byron Brown in Buffalo. And he has recently put out a 10-point plan on lead. He has convened the community foundation, the contractors, the nonprofit organizations, and I think this is where I am such a big believer in mayors and county executives in really having the bully pulpit. So we put people on the ground all over the country. We call them outcome brokers to help drive this collaboration that is needed not only for lead, but health-based housing and improving energy efficiency and bringing those resources together. So I agree that it is critical that there be local leaders. And the Community Foundation in Buffalo has been one along with the mayor there. In the state of Rhode Island, it's the Community Foundation, the Rhode Island Community Foundation, that helped to really drive along with, at the time, a great local leader in Sheldon Whitehouse as the Attorney General, who took on and is pushing this. But we have to identify those local leaders that happen. We've been very fortunate in Maryland by making the business case and proving it out governor to governor to governor that lead poisoning prevention works, that more holistic housing around healthy, safe, and energy efficient housing work. Let me give one bit of advice, so there's a strategic plan to end childhood lead poisoning and blueprint for action in the back that we've done for the federal government. But that has to happen at every local level. And we learned a great lesson in 2000 when Paris Glendenning was the governor of Maryland, that Maryland was adrift a bit and didn't have really the firm plan it needed to what was going to go forward in the future. So we wrote a strategic plan called Windows of Opportunity. And we asked for $50 million for the city of Baltimore for 3 years. And in the absence of them having a plan, they adopted our plan. And it put it into motion. And they also gave us every dollar of the $50 million that we asked for. So lesson number 1, ask for what you really need. Don't do what we did and ask for not enough, right? And make sure that you are convening through your local community foundation or through your local leadership, or when there are transitions at the mayoral level or otherwise, that we are making the human case, the moral case, and the business case. And the other piece, and what in Baltimore really fired us up many years ago, was our police chief, Thomas Frazier, our state's attorney, Patricia Jessamy, and our schools chief came to us with the Coalition on Childhood Lead Poisoning and said, we are dealing with this after the fact. Go after those educational funders and engage them. Go after the healthcare funders. Push the hospital community benefit funding, but also, like in Michigan, where they've gotten CMS money, in Maryland, which pales well in comparison, our state legislature has a model program going on through using state Medicaid dollars today to do lead hazard control and abatement to prove out the health cost. But it's the juvenile justice cost, it's the education cost, and all of those funders need to be together at the table.
A great example of collective impact. Wesley, you talked about this a little bit, about some of the recent challenges with water-related lead-related water-related issues in Flint. And, you know, I would love to hear a little bit more about how that's helped shape some of the state policy in Michigan, what's come out of it, and what lessons are there for other states or regions to learn.
So when this crisis hit, we said, how could it be the water? HUD doesn't require us to test water. So the funding that I have is limited. We can't test water. We've learned from this process. We're learning all the time about how water impacts the families. You know, there's the water that's dissolved, and then the lead that's dissolved in the water, and then there's lead particulate in the water that gets knocked loose. So we're learning more about that. It was an awakening for everybody in the state, including the DEQ that was overseeing this, just what was happening with Flint. This was unique for us. So I would say that the greatest impact is for our time there, me and my staff and some of the lead advocates, we were the only lead experts in the state. Now everybody's a lead expert. And isn't that what you really want for advocacy, is everybody saying, hey, I'm a lead expert? And that's the greatest thing that's happened with the water. So we're still learning about the water. We've revised how we sample water. I mean, we didn't sample it before, but now we have a plan. We take 14 samples in each home. So we've become more astute at where we're collecting those samples, how we collect the samples, the sample size of the bottle. We're in the house that we're sampling. We had 2 dogs. One dog had to be put down because of acute toxic lead poisoning in Flint because it was drinking from the outside faucet. How many children drink from the outside faucet? The EPA doesn't require non-potable water faucets to be lead-free. That's still the case today.
Thank you. So if we can prep the first question on the floor, I don't know who has microphones, but if you have a question now, please raise your hand and someone will come to you with a mic. But I'm actually going to take the first question from our Slido technology here. And I have a question for Ms. Gould. Can you repeat how many IQ points are being lost to lead at this point?
Yes, absolutely. So as I said before, IQ loss happens non-linearly, so at very low levels, the marginal cost of each higher lead level is actually higher than it is at the very highest levels when so much damage has already been done. So it calls to the importance of reducing lead levels as much as possible, not to 10, not to 5, but below 2. So I just wanted to make that point. And then my research shows that extrapolating from that, the estimated IQ loss is between 9.3 and 13.1 million points. And that was the cost then using those lifetime earnings estimates of $165 to $233 billion. Again, that's just for one cohort of children under 6. And you could think that cohort repeats. So, hope that answers your question.
Thanks. And we'll go through a few questions and then hopefully we'll have some time for some final thoughts before we wrap up. Question on the floor?
So in 1986, I published the IQ earnings relationship, the economics of that. It's really interesting to hear it here and to be talking about the benefits. But drinking water is really the big benefit for remediation because lead is a corrosion byproduct in the drinking water. So the way that you get rid of it is you reduce how corrosive the water is. So your hot water heaters and radiators and pipes and faucets all last much longer. So the immediate direct plumbing benefits are about 10 to 1 to the cost of treatment. All the health is free. So the real argument, cost-benefit argument for lead treatment prevention is for drinking water.
No question? Could I? Response from the
Well,
panel.
I just wanted to make a point that one of the limitations of these cost-benefit analyses, which I think, by the way, are great, it doesn't say who benefits and who pays the cost, right? And so that's just a limitation in the way it's done, but we need to focus on that. So one of your questions up here, does permanent lead remediation increase the real estate value of the home? And the answer is no, it should, but the appraisers who come into homes and monetize these investments don't know how to do that for lead abatement. So if we want to, part of it is about government funding, but part of it is getting the market to work right so that we recognize the defect, whether it's like a leak in the roof or something else. Appraisers know how to monetize that. We should do the same thing for this field as well. And so we went to the appraisers in the early 90s. It's time to go back to them and say, look, we got a lot of evidence here. Let's put a dollar sign on what it's going to take to fix this problem. And then the market can hopefully work for at least some of the households.
So
Right, the issue is who pays and who benefits, and that's true for all of these.
Right.
So one of the questions that has a lot of thumbs up, I want to try to word tactfully, is you can develop great policy, innovative policy, but its actual application, when we could talk about enforcement, we can talk about other things. So on one aspect, it's like holding up that model and getting it passed and having it move forward. But then how do you take that policy and move into actual implementation? So I'd perhaps pose that for anyone on the panel, kind of talk about that transition from taking it off the shelf and getting it on the ground.
No, in a lot of communities that are doing this for the first time, we know from our data analysis in Baltimore, where we've reduced lead poisoning by 98%. I just underscore that, right? It's incredibly important. We still have ways to go. The fear in the legislature and the opposition at the time was that if we set the standards, then investment would leave communities, right? And that we would have high abandonment in response to setting and enforcing standards. And actually, Anthony, what we know is the opposite is true. Where we have upheld the standards, where we've had very good cooperation from local housing code and state, from the Maryland Department of the Environment in enforcing and taking people to court and doing cleanup, right? It has spurred investment. It has lowered crime in those census tracts, and we have better performance in schools. So, data matters. Data with a soul, that is the story of families and the story of communities matter. But where we uphold standards and where we can prove that to a local legislator, right, or elected official, that we can prove it within their term, also important. And the people will benefit. And what we began to have is property owners telling the local leaders that they were benefiting because their maintenance costs were better, because stabilization was better, they had better tenancy. Those things matter. To me, I want to know about the child who goes and can read and be a success story for the National Grade Level Reading Campaign, right? Mm-hmm. But for a local legislator, for a mayor, it is, can you prove that success in a way that translates?
So this is a great segue to a question that's on the top of the board now. One where, when it comes to local policy recommendations, who on the city executive level should be engaged beyond the mayor? And, there's a reference to the health inspector or city council member as natural high targets. What a lot of folks aren't aware is in this country, there's over 19,000 different municipalities of different shapes and sizes. Very few of them actually have strong mayor, executive level forms of government. So large cities like Baltimore and New York, you have really strong mayors, but the majority of the country, you have more of a city manager, council manager form of government. And so the role of the executive, kind of like day-to-day policy implementation, decision-making process, is the little unknown city manager. So if anyone on the panel kind of want to talk about that experience, and this is, and true for a lot of cities that you're working with.
Yeah. I'll let others speak here.
I don't know there's a single answer. I mean, I think the key thing is that at the local level as well as at the federal level, the way we should cast this problem, it seems to me, is that this is solvable. When I was at HUD, I used to go to the Hill and argue for HUD's appropriation. Staffers would say, we like lead because there's light at the end of this tunnel. We can actually fix this problem. And so it was more, it was tractable. And that's the first thing they teach you in policy school, right? It has to be tractable. The same thing should work at the local level. Make sure that yes, it's a big problem. And it's going to, there's a cost associated with it. But it's solvable. And that's the key thing I think that we need to get better at articulating.
Questions on the floor that we haven't heard from or seen on the board? While we get the mic to that next person, I think you were going to say something.
Yeah, I was. I mean, this goes right back to what I was saying before. We have health inspector or city council members in the city, but where's the housing inspector? How many housing inspectors do we have here today? We have to keep those people engaged. And recently, a lot of federal funds to housing inspectors have dried up. The community development block grant dollars. That's who pays for those positions. And that's a key group that we have to keep funded, keep engaged, and they will help make a big difference.
I think it has to be an army, right? You have to get the local contractors trained and know that there is an opportunity for them. You have to engage teachers. I have spent many hours in classrooms where teachers can literally walk up to children with lead levels without ever having seen a lead test and know which child has been disrupted because of lead poisoning. We have to have a strong voice of the foundations in the community, the education leaders, the healthcare leaders. We really need to do that. But I saw a question here about political dissonance, right? One thing matters, and we've said it, we heard it from Governor Ehrlich, we're going to hear it from others. This is a provable case, it's a preventable case, and we just have to be committed to that true north of staying on the focus of prevention and the standard of prevention and continually talking about it at every level. People don't like to invite me to cocktail parties because this is what I want to talk about. They try to give me a lot of drinks to get me to come, but which I don't take. But I think
Same problem, actually.
I just
so
want
Dave and I go to the same cocktail party.
to be able to take another question from the floor, but I want to add a little bit to that point. I think a lot of folks don't realize, even within the cities themselves, the departments, to Wes's point, are fragmented and sometimes siloed. The health department isn't working collectively and collaboratively with the code enforcement or the housing department. And so, as advocates and people in your cities who want to make a difference, helping bring those folks together to the extent you can be a really great role. Because you'll have, in each one of those departments, really dedicated and caring folks, but the left hand doesn't necessarily work the best for the right hand, and then you can be that medium to help bring those folks together. Another question on the floor before we move into final thoughts from our panel.
Warren Friedman from U.S. Department of Housing and Urban Development. A piece of news for some people, but then comments, perhaps starting with Wes, but also perhaps Ruth Ann. On November 30th, the Center for Medicare and Medicaid Services posted on their CMS.gov website an update to their state Medicaid manual, and it included a pretty interesting item. It said, Medicaid also provides reimbursement for lead investigations in the home or primary residence of the child with an EBLL. And this is relatively new. It's something, as Dave Jacobs mentioned, HUD has been working on for a long time, others have as well. So this is progress. I would note that the EBLL level that Medicaid uses is 10 micrograms per deciliter, not 5, but it's certainly less than 15, which had been used elsewhere within DHHS. So, Wes, your comments about good news and other opportunities for expanding Medicaid-related efforts.
Thank you. So we just have a few minutes. I don't know if everyone wants to
Did Wes
weigh
want to
in.
comment?
I don't think there was a question.
Oh, well, let me comment back and say, number one, thank you for giving us something that we can all do, which is work to get the Center for Medicaid Services in line with the threshold level of prevention by lowering that blood lead level. I do think this is having the healthcare investment partner in investigations and assessments critical. One thing I do think that the healthcare side of this, Medicaid and other insurers have to think about is they should pay for investigation and assessment in every home that is potentially at risk, because the goal is no child's poisoned. The first and foremost people who should be putting that forward are that. But I think this opens the door to the continued movement. And God love you, Dr. Friedman, because you read the regulations and are able to tell us that, and I love people like you, so thank you for that.
Just continue transitioning into final thoughts
You want
before.
to start with Elise and come down?
Sure, I mean, I think this has been great. I think that one of the points that Dr. Jacobs made was that some of the benefits that we see maybe accrue not necessarily to the government, maybe accrue to individuals, accrue to the education system. I think it's very important that they all work together, but even if we were to just look at the benefits that accrue, let's say, to the government in terms of lost tax revenue, that would be enough. That alone is enough of a business case to make those kind of investments. It's sure, you don't see those investments bear out in terms of the fruit the next year. You're talking about kids, you're talking about when they become adults. Those are sizable costs, not only to themselves, to their families, to their local community, but to tax revenue overall. So I think looking at each of those different pieces and working together in collaboration and making those important investments are going to really pay out in the future. Thank you.
And I'd just like to build on a point that you made. And when we're thinking about policies for kids with elevated blood levels, of course we need to target kids who have these highest levels. But the recent literature shows that there's adverse effects even well below 5 micrograms per deciliter in terms of IQ loss and attention-related issues. So it's not just those, roughly 500,000 kids who are above 5 micrograms per deciliter. It's all the kids that are exposed even, down below that level that are still at risk. So I don't want to forget about them as we're talking.
I'm going to be quick here just to say there used to be an old ad, the Priem oil filter ad, for those of you who are at least 50 or above might remember, and it said, "Pay me now or pay me later." And we should never pay in a child's ability to read. We should never compromise somebody's ability to earn and compete. If we want to solve a lot of things in this country, we have to start with leveling the playing field by ensuring that kids grow up in housing that does not harm them. And then we can start to have a real conversation. And what we have in our grasp, because of all of these brilliant people and all of you, is a winnable argument. So have a plan. We'll help you have a plan. Be committed to collaboration and be committed to talking every day about what we know. And that is that preventing lead poisoning works.
I would just say that many of you, some of you anyway, the vision for this meeting was to not have the usual conversation about lead, but to open it up more broadly to people from other areas. So we need to help us figure out, what are we missing here? Why isn't this, for the life of me, I actually don't understand why we haven't addressed this earlier. It seems so obvious, but we're obviously missing something. So those of you who are new to this issue, we need some new blood. And so it's important to get your perspective as we go forward. Just one final note. When I was, we helped do that President's Task Force at the time. I think I underestimated how important that interagency collaboration was in getting different perspectives. That's something that we need to do a better job of. So I'm hopeful that in the days and weeks to come that we'll be able to build off this meeting and others like it so that we'll get those new perspectives so that we make the case even more compelling than it has historically been.
It can be done. Before Flint, there was a group of us, Rebecca's part of that, called the Michigan Alliance for Lead Safe Housing. For 15 years, we advocated, and we finally got general fund dollars from the state of Michigan from a conservative governor. And the champion for that was our most conservative state senator. He said, "I get it." So we are still receiving $1.75 million from the general fund from those efforts. And those monies will be used as part of the match for the CHIP Medicaid dollars. So it can be done.
So my former boss used to like to say, and I do say about being a prisoner of hope. And so I'll encourage us not just to be prisoners of hope, but also wardens of action. So thank you for your time this morning.